BP gel, or benzoyl peroxide gel, is commonly used to treat mild to moderate acne in certain skin conditions like rosacea. It works by reducing acne-causing bacteria and causing the skin to dry and peel. BP gel may also help decrease symptoms caused by rosacea, such as pimples and bumps on the face. It's important to check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. Be sure to use BP gel as directed by your healthcare provider, and never take the wrong product, as it could harm you. Always follow the recommended dosage and apply at the best time for your skin. Before using BP gel to treat acne for the first time, it's important to check if you are allergic to it. Put a small amount on 1 or 2 small areas of acne for 3 days to test for any allergic reaction. If you don't have a reaction, you can continue to use the product. There are different types of benzoyl peroxide products available, some of which may require a prescription. It's best to consult your doctor or pharmacist to determine the best product for your needs. If you are using the over-the-counter product, be sure to read and follow all directions on the product package before using the medication. When applying BP gel to the affected area, be sure to wash the area with a mild cleanser and pat dry before applying the medication. The dosage and frequency of use will depend on your specific medical condition and response to the therapy. Improvement in acne or rosacea is usually seen after 3 to 4 weeks of use, with maximum benefit after 8 to 12 weeks of use. If you experience any adverse effects or if your condition worsens, it's important to seek medical help right away. Some common skin reactions such as peeling, itching, irritation, and reddened skin may occur, especially at the beginning of treatment. If these effects persist or worsen, it's important to speak with your doctor or pharmacist. They may suggest using smaller amounts of the medication or using it less frequently. Always consult with your healthcare provider for more details. Remember that your doctor has determined that the benefits of using this medication outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. While it is rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, it's crucial to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects. You can also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, and report them to Health Canada at 1-866-234-2345. Before using BP gel, it's important to let your doctor know if you have any allergies, as this product may contain ingredients that can cause allergic reactions. You should also inform your doctor about your medical history and any other medications or herbal products you may be using. It's important to be cautious in the sun while using this medication, as it can make you more sensitive to sunlight. Be sure to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you are pregnant, you should only use this medication if it's clearly needed. Be sure to discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if the drug passes into breast milk. When using BP gel, it's important to be aware of potential drug interactions. Certain medications or products used on the skin, like dapsone, may affect how BP gel works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and discuss it with your doctor and pharmacist. Never make changes to your medication dosage without consulting your doctor first. If BP gel is swallowed, it can be harmful. In the case of an overdose with serious symptoms like passing out or difficulty breathing, it is important to seek medical help immediately. In the U.S., residents can contact their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Always keep this medication out of reach of children and pets to avoid accidental ingestion. Make sure to keep all your regular medical appointments and any scheduled lab visits while using BP gel. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you forget to use BP gel at your regular time, use it as soon as you remember. If it's close to your next scheduled dose, just skip the missed dose and continue with your regular schedule. Do not use a double dose to make up for the missed one. When it comes to storing BP gel, it's important to keep it at room temperature. Different brands may have different storage needs, so be sure to check the product package for specific instructions or ask your pharmacist for guidance. It's crucial to keep all medications out of reach of children and pets. When it comes to disposing of BP gel, make sure not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or you no longer need it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.